Korn-Bursztyn, and I'm a licensed psychologist and psychoanalyst, and I've been professor at Brooklyn College since February of 1991. So I'm by training an early childhood educator, and I worked for many years in early childhood teacher education. And I also revived our early childhood center and headed it up for 17 years before I came to to establish the Play Therapy Project and the Advanced Certificate in Play Therapy program. Okay, so play therapy is another word for how we work with children. Now, because children are so expressive in many different sensory media, we need to provide them with opportunities for them to be able to express what's inside and be able to communicate. And we know that the very act of play is in and of itself very therapeutic for children. So in this modality, which is really the only way of working with young children, and we're going to see how play therapy is adapted for use across the age spectrum, and how even in adulthood, this idea of a playful interaction that connects you with the other takes the form in adult psychotherapy of playful exchanges, the use of humor, and also the encouragement of budding creativity and imagination. So in play therapy, what we do is we encourage the child to develop initiative. So we are a developmentally appropriate practice in which we follow the child's inclinations, we follow the child's developmental line of progress, and we encourage the child to choose activities, to engage in play. We help to scaffold that play. We set the appropriate structures so that the child can have freedom within the limits. And we work with children to both express their life circumstances, and many of the children with whom we work are children with adverse life experiences. So we provide opportunity for them to express what has happened to them, not only verbally, but now non-verbally, through art materials, through play materials, through natural materials such as sand and water and clay. So I'd like to just walk you through a bunch of different things that we use with our students in the play therapy program. They come here and we play. We use a case-based approach in which our graduate students take the role of play therapists. They take the role of the child, kind of inhabiting the experience of being the child, and also the roles of parent or family members. So let me walk you around the space and show you some of the materials that we use. Okay, so we have doll figures, many different dolls, softer dolls. We have puppets, and I'd also like to show you some of the puppets that the students in our program have created. We have a fantastic partnership with the Puppetry and Practice Workshop here at Brooklyn College. So we use puppets, we use dolls, we work with the students around how to use puppetry, how to work with puppets in order to help children express what's inside of them by being able to project it onto a puppet. So it's never about themselves, it's about this puppet who really got in trouble, which we find really takes the burden off children. So we have our dolls, we have our dollhouse with lots of different props, little figures, furniture, which, by the way, we use some of these very same materials in our sandbox, which is a fantastic medium for people to build an experience of their daily life in. So I'll show that to you in just a moment. So going around the room here, we have different kinds of materials for clay, and I think it's really important to have a wide variety of materials that you can mold. So for the younger child, the very young child, we've got the Play-Doh. We have for your preschoolers, we have also the air drying clay. We have various kinds of modeling clay. We have some nifty kinds of plasticine clay and various different kinds of clay-based materials that are actually very nice for people to hold, especially the older children. Very nice for them to hold and to create some figures, because it's easier for all of us to talk when we're doing something. When the pressure off talking and off the cognitive demand to translate affect, to translate feelings into words is kind of lifted from us. So we have the clay. We have also various different kinds of materials. And again, it's so important for the person, for the play therapy practitioner, to tailor the materials to the child or the group of children that the play therapist is working with. So let me just show you some of the different kinds of materials that we use. So these are the arts-based materials. So we've got the washable children's paints, the tempera paints, with nice paper that can absorb the paint and hold up and not tear. We've got watercolor paints. We have finger paints as well, with finger paint paper. We have the colored pencils. We have those familiar crayons that bring back the smell of childhood to adults. We also have the crayons, the oil pastels. So we try also always to make sure that we have materials that are going to be very attractive also to the older students. So we have colored pencils and markers. We have also pencils, artist pencils and erasers, so that people can experiment with line and shape and mixed media. We have also collage materials. Now, collage materials are just fantastic for working with. So we have a box of different fabrics that people can choose, and scissors that they can cut with, all kinds of interesting threads. And my personal favorite are the buttons. So collections of buttons and all different kinds of ornamentation. Fancy papers, interesting kinds of papers to use and to cut, and our glue, and especially for the younger children just love the glitter glue. So we like to offer a lot of different opportunities for children to do, because the sight of materials, especially art materials, play materials, very deeply reassuring to children. It's like, I know what to do with these. And it just sets the stage for children and the play therapy practitioner to develop a very close working relationship. What we do at Brooklyn College that's really unique to us, that I believe is not replicated elsewhere, is that in our approach, we emphasize culturally competent play therapy, and we base it on the developing relationship between the play therapy practitioner and the child and family. So we call what we do relationally competent play therapy. And that's very much a Brooklyn-based concept, because we want our students to be able to learn the concepts of how we work and then go out into the field, into their communities, into the schools and the community-based organizations where they work, and adapt the concepts to fit the needs of their communities so that it can get taken up. Okay, and so here's another one of my personal favorites, and that is the sand tray, the sandbox. So what we do in the sandbox is that we make available to the children that we work with all kinds of different materials, essentially the same kinds of materials that you might find in a dollhouse, plus some other kinds of objects. I should add also that although we have roughly, the space is divided into roughly different areas, an important concept in working with children is that they can move the materials from one area to another. So let me show you some of the materials that we provide for children. So we have various human figures that we provide, and those are some of the more rigid plastic figures. We have some of the softer doll-like figures with the bendable legs. We have vehicles. We have dollhouse kinds of furniture for creating scenes. And children sometimes will recreate scenes of everyday life in their own lived experience, or their imagined lived experience, or in those experiences in which they're mastering their fears or traumatic experiences. We provide also, and this is a big favorite among children, dinosaurs, lots of ferocious figures with teeth, right? We provide also, and these are still on the shelf. Let me show you. We provide all kinds of different animal figures, domesticated animals, wild animal figures, lots and lots of different materials that the children can choose from. And so when we work with our graduate students here, they select the play materials in accordance with the case that they're working with. Is a child-centered approach. So what we like to do, because we are working on the child being able to develop initiative, because the capacity to develop initiative and to organize one's experience in space is a very empowering experience. So again, depending on the child. If we're working with a child who we know can get very distracted by having too much around, well then we're going to leave a narrower selection of materials out, but we want that child to be able to exercise choice. So what the play therapy practitioner needs to do, and this is very similar, if not identical, to what an educator, an early childhood educator does, is think very carefully about the child's needs and how does the child need the adult to structure the environment so that the child can maximally explore and thereby develop greater social emotional growth and also cognitive development. So typically, if a child is not overwhelmed by choice, then the child chooses what the child wants to do. Sometimes a play therapy practitioner might suggest an activity. So for example, a child comes to a session and the child is very distressed and having a very hard time being able to articulate what is it that the child is distressed about. Very often clay, sand are enormously soothing. I like also to have water available for children, especially for the younger children. It has a very, very soothing effect. The play therapy practitioner will help the child to scaffold the play, begin to expand the play. Well, where might those cars be going? Let's build a house. Let's build a neighborhood. We'll begin to scaffold the play with the aim now of enhancing the child's ability to engage in symbolic function. Children are often referred for play therapy because they're struggling. Very typically, children might be having difficulty socially in school, hitting. Maybe children are not talking in school. Maybe they're talking at home. They're not talking in school. Their academic adjustment has begun to fall off. There might be changes. Parents often will refer a child when the child begins to display symptoms of distress, so regressed, a return to behavior that was more typical of the younger child. Sometimes parents will ask for children to have some added support when they know they're going through experiences that are impacting on the child's life, as when parents are in the process of separating and divorcing. It's very, very helpful for children to be able to have a space in which they can explore their feelings, explore their mixed feelings, and be able to give expression to them, and for the practitioner then to be able to work with the parents to help ease the child's transition. The beauty of play therapy is that it doesn't rely exclusively on language. And remember that even for children who are verbally fluent, they become profoundly uncomfortable. Many children become profoundly uncomfortable when in a situation that they're needing to speak with an adult. Because the adult-to-child relationship is inherently unequal. No matter how nice, how friendly you are, you're the adult, the child feels herself at the child's level. Now for children who are nonverbal or whose language is emerging, play therapy can also play a very important role in scaffolding the language development. And we have had a number of speech and language pathologists that have been in our program learning how to work with materials, how to use tracking language to describe what the child is doing. And so we use language as a tool to bolster children's early literacy development, their early language development as well. And we're also working in the nonverbal register of human communication. And so that's where the relationship is so important. So we're building the joint attention, that the child experiences the therapist as someone who's interested in the same thing that the child is interested in. And so we want to scaffold that back and forth communication so that the child now becomes more comfortable with language. Language becomes part of that human relationship. My final message is that the single most important thing, I think, in helping children and working with children is that you just have to love being with children. And it's very hard for a lot of adults to play again. And we need a little practice in it, but children are perfectly willing to teach us. So to have the courage, put the screens aside, put the expertise aside, and be able to enjoy the interaction with children, because that also in and of itself helps children to grow. So have fun with it.